What's going on, everyone? Happy Wednesday. Hopefully everyone is doing well, staying safe, healthy, and having a great day so far. If you had to take a COVID test, flu test, or a test for some other virus, I hope you have tested negative. If you did test positive for COVID, flu, or any of the viruses, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Wednesday edition of the Virus Update for Wednesday, April 9th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of different viruses out there. You need to be informed with what's going on with each and every one of these viruses. And to be honest, back during the winter months, I think a lot of people can raise their hands and say they know someone who either got sick and went on to be hospitalized, or even worse, died. Yeah, I can raise my hand to that. Not only did I have COVID back during the holidays, back around just after Christmas time, I can also raise my hand to say that I know someone who passed away of one of the viruses, sadly, just recently, a relative. Anywho, moving on. If you're new to my channel and want to be informed with the latest news and data of everything, subscribe down below. Give this a thumbs up. Hit that notification bell and share this video with anyone that you know. All right, we do have several news stories today, and I do have some news of my own. Yes, I made a little addition to the data report family. You'll see that in just a little bit. And of course, we're going to take a look at some daily data, and I think we will get in some wastewater sites today as well, and who knows, maybe a couple other things. All right, starting off with measles. We do have several stories when it comes to measles. Kansas reports first measles hospitalization as the outbreak continues to grow among the unvaccinated. So, yes, Kansas is now up to 32 cases of measles, and this does now include one hospitalized case of measles. So, yeah, not a good thing there. And in Knox County, Ohio, measles outbreak has now reached 14 confirmed cases. Reported cases of measles in Knox County have nearly quadrupled in 10 days, according to an update from the Knox Public Health. In an update news release issued Tuesday evening, there are now 14 confirmed cases of measles in Knox County, 7 of which are from Ohio residents linked to the initial case of measles announced late last month. And it sounds like these people have isolated themselves, and their symptoms are being monitored throughout the isolation period. So, yeah, that's not good. Then we come to this. I have to correct myself on something with Colorado yesterday. 2 more measles cases were confirmed in Colorado. This is Grand Junction, Colorado. There are now 3 confirmed cases of measles in Colorado. Denver Department of Public Health and Environment, DDPHE, has confirmed their first case of measles for 2025. Measles was found in an infant who was too young to be vaccinated during a routine vaccination schedule. The infant had traveled to Mexico in an area with an ongoing measles outbreak. So that's the latest from Colorado that corrects anything I may have said yesterday, which may have been incorrect. All right, moving on now to this. And over in Hawaii, it sounds like in Maui, Hawaii, it sounds like that Hawaii is now reporting its first case of measles in a child that's under the age of 5 who was unvaccinated and recently returned from an international trip. Now moving on to Florida, where a case of whooping cough has been reported at the Broward Elementary School. Yes, it sounds like the principal of a Broward County elementary school has alerted parents to potential whooping cough exposure. And, yeah, this is something that's a problem. This is not the first school recently that we've seen with whooping cough. I'll make sure this gets to the archive. We do have a tracking thread for school illness on my site. We'll get that there. Also update the measles. I do believe we have something else related to a school. And I do believe that is in Maryland. Yes, I believe this is in Maryland. Bester Elementary School is working to contain an illness. Apparently there is an illness that is going around, and it has made several people sick. And this is in the Hagerstown, Maryland area. The school is currently closed because they don't know what the illness is at this point. And until they can sanitize and clean the building, you know, all the usual stuff that they do, that school is going to be closed. So we'll have to see if that school reopens tomorrow. But yes, at this time, this elementary school is closed because they're working to figure out what an illness was reported. And it sounds like this has later spread to other areas of the school. And yeah, again, I'm not seeing what the illness is, and they don't know what it is. Could it be COVID? Could it be flu? Could it be norovirus? Who knows? Flu-related deaths in North Carolina top more than 500 for the season. This is the highest number since 2009, and it sounds like there's a couple different stories out about this. Sounds like 2009 was when they started tracking flu deaths in North Carolina, because they're saying here this is one of the highest. Yeah, let's read this. Wednesday, let's go back. 2024-2025 flu season has been very active and deadly in North Carolina. Wednesday, the North Carolina Department of Health and Humane Services said their latest data shows there have been more than 500 flu-related deaths statewide. The agency said this is their highest number of flu deaths reported since 2009 and since they started collecting data. Wow. So I don't know that they started in 2009, but this is the highest number since 2009 and the highest since they started collecting data. So the only time that got close to this was 2009. So wow, this is really bad. And a lot of these agencies, they started back in the 2000s. I think the CDC online data started back in the early 2000s sometime. Someone let me know if they know the actual year down below. I think we read it one time before, didn't we? All right, moving on to this. This is something locally that I saw. This is really interesting. Gum containing bean powder can reduce transmission of flu, herpes. UPenn Dental Medicine study finds. Yeah, this is really interesting. Chewing gum made from beans has been shown to reduce the viral load of some strains of herpes and influenza, according to a new study from the University of Pennsylvania School of Dental Medicine. This is really fantastic news. How often do we get good news? It's not every day, and I'm glad we got this today. The full study. I'm going to put it in the flu studies archive on my website. That's really what my website is. It's an archive of information. Datareport.info. I'm going to put it on there, and you'll be able to read the full study. This is really interesting. We're not going to sit here and read the full study, but just want to let you know that, hey, chewing gum made from, what was that again? Yeah, chewing gum made from beans. It can reduce the transmission of flu. That's remarkable. All right, moving on to some COVID cases now in New Zealand. And this week's update in New Zealand shows a down arrow next to the cases. 53 average cases and trending down. Rats uploaded average is at 142 cases in hospital as of at midnight Sunday. That is 58 cases in the ICU. That's never reported. One death attributed to COVID. Total deaths attributed to COVID is currently at 4,617. Recovered 479. 6 deceased. And yeah, again, the total number of deaths there is 4,617. Reinfections 291. 2 reinfections in the last 90 days. Taking a look at this from Dennis the COVID Guy. This is the respiratory surveillance report for Queensland. This is a part of Australia for April 2nd to April 8th. And we can see here, COVID, 502 cases reported. That's down by 2.7%. But the good news stops there, and then comes some bad news. Influenza. Yeah, this is really bad. 1,594 cases. That's up by 41.3%. RSV, 852 cases. That's up by 27.3%. And you know how sometimes I say, oh, it's such a high percent, but don't be so alarmed. In this case, for that area, yeah, they're going up pretty quickly. So this is not good. Hospitalizations. Okay, here's some good news. 81 COVID hospitalizations. Never good for anyone to be hospitalized. That's down by 13.8%. But it stops there. Influenza, 94. That's up by 25.3%. And RSV at this time is 54. And that should have a plus. Or excuse me, RSV 57. That should have up by 54%. And he did correct down below to say that. So, yeah, this is interesting to note at this time. That's the update from Queensland. All right, moving on to this. I made a little announcement yesterday on here saying I was considering starting a Facebook page for my brand name, Data Report. You know, datareport.info, the YouTube channel, everything, all the other socials. And I said, you know what, I'm going to take a poll on that. Well, only 91 votes, but 84.6% of people said yes, they would follow me on Facebook, on a Facebook page. I mean, I've been on Facebook for many, many years, just have not had a page for my channel or anything else that I do. So we have created that new Facebook page. I'm going to start incorporating that into the description down below so you'll be able to see it. Here it is. I'm not logged in at the moment. I'm on a different browser here, but here's my new Facebook page for Data Report. And take a look at this post we did this morning. I had my next Xolair injection today. Take a look at the air quality that I got initially when I was there. 579. Now, it went up a little bit after that. It went up to the low to mid 600s. Okay, that's pretty darn good if you ask me. But yes, this is the new page. I'm not going to be sharing as many things on there as I share on X or Blue Sky. I'm mainly going to be sharing the videos, maybe a few things like that. Maybe some screenshots of wastewater charts or some other data, that type stuff. I don't think I'm really going to be posting news stories on there, unless there's something big and breaking popping, like, I don't know, someone dies of H5N1, stuff like that. I'm not going to be posting every single news story. So I'm going to try not to overwhelm it with the number of posts, but I am going to post there at least a couple times a day. And of course, every day I will post the latest virus update there. And hey, take a look at that. We already got a few likes and followers on there. Who knows? Maybe we'll gain some more. Data Report. Go search for that on the Facebook search tab, and you might find it. Alrighty, moving on. We'll get our update from the UK tomorrow. Nothing really to show you on the website. I don't know that I'm going to be able to get much done on the website this evening. I'm going back out to work later on, so we'll see. Definitely over the weekend, there will be some updates coming. I'll do some more work on the COVID positive archive and whatever else needs to be added. Taking a look at what's going on with bird migration traffic today. And we can see here there is some bird migration ongoing in the Central Plains today and in a few other areas at this time. And with that comes the risk. You can see here, look at that. That's a pretty heavy migration traffic. And those are millions of birds at a time. Look at that, 130 million birds. So there's the risk that bird flu could be spreading. You can see also the West Coast had a little bit of migration traffic today as well. So we'll have to keep an eye for some new bird flu H5N1 outbreaks. Not seeing any just yet. We are seeing this, though. Some bad air qualities today in portions of California. Also some bad air qualities ongoing across portions of Wisconsin, Minnesota, Michigan, and portions of the plains as well. So we'll keep our eyes on that. Pollen levels, they are still a problem in the southeast, and they are also a problem across portions of the west as well. And eventually that will spread to the north. But right now, up here, we're dealing with some cooler weather. And even though it's not raining today, yeah, there could be a little bit of pollen, but that air is going to get cleaned a little bit over the weekend because we do have some rain coming late in the week for the northeast. Take a look at this. Pinellas County, Florida. We're seeing a lot of sick person calls. 1, 2, 3, 4, 5 of them. Breathing difficulty, diabetic problems, chest pains a couple times, stroke a couple times. Not good to see that many calls right now. Taking a look at what's going on in Philadelphia yesterday. 690 EMS incidents is what was reported. Hey, that's a good number. That is below 700, which is really positive information. Take a look at this, though. Currently in Montgomery County, Pennsylvania, yeah, there's a lot of things going on. Look at respiratory emergency. 1, 2, 3, 4, 5 respiratory emergencies right now. Stroke is showing up. Carbon monoxide detector, that's never a good thing. Yeah, just a whole bunch of things going on. So really busy for ambulances in Montgomery County, Pennsylvania right now. Chester County, wow, Chester County, Pennsylvania, really busy as well. We see heart problems showing up multiple times. We see sick person multiple times. Yeah, this is about the busiest we've seen in a while for outside of Philadelphia. But again, Philadelphia, on the other hand, was not as busy. So make it make sense. That's just really strange how the city's not busy, but just outside the city is busy. When we take a look at the hospital situation in Pennsylvania, and you know what, we're going to use this on the left here. We can see here, yeah, there's a few hospitals in Pennsylvania dealing with problems. We do see emergency department overcrowding. A couple of them are reporting behavioral health issues. But again, majority of the hospitals are okay. Southeast Pennsylvania is doing okay, but I gotta draw your attention back to this once again, because unfortunately we do have some more bad news. Crozer Chester Medical Center and Ridley, this is Taylor Hospital in Ridley. Unless something's done, I have not seen an update today. This is as of me watching the news last night. Unless something's done, sounds like these two hospitals could once again be shutting down as early as today. So, yeah, I hope there is a last-minute rescue for these hospitals. It had looked like maybe there was going to be a rescue, and now they're saying, no, we need more funding in order to keep these hospitals going. So, yeah, very bad news about those two hospitals. Moving across the Delaware River into New Jersey, there are a few pediatric issues showing up here, but overall, the hospitals in New Jersey are not doing too bad today. Yeah, psychiatric issue, I should say, not pediatric. University Hospital is having a psychiatric issue. It looks like there is a 4-hour adult divert for that at this time. So that is not a good thing. New York State, 794 people have tested positive at this time for COVID. And taking a look at the hospitalizations, they did drop today. 404 people in a hospital in New York City and 43 people in the ICU. This is New York City. What I first showed you was New York State COVID cases, 794. New York City's COVID cases will get added into that number tomorrow. Now taking a look at the statewide level for COVID hospitalizations in New York State, and you can see that has dropped as well, 787 and 81 people in the ICU. I'm encouraged. I hope it continues to drop. All right, let's take a look at some wastewater data, shall we? And we're just going to randomly go to some wastewater sites today. Let's go first to California. Let's see what's going on in Sacramento, California. And in Sacramento, we do see COVID levels are in the low category at this time. And it looks like they're holding steady. RSV is medium and dropping. Influenza A is medium at this time. Influenza B, that's listed in the high category. HMPV is high and rising slightly. EVD68 is high. Norovirus, a little bit of an increase at this time. I'm not happy to see that. Hepatitis A is low at this time. And Mpox, Clade 1B, yeah, there was a detection of that back on March 18th. Now, we also want to take a look at what's going on in Arizona and New Mexico. And in order to do that, we need to go to the CDC page. So let's take a look at what's going on with Arizona and New Mexico's COVID levels at this time. We're going to change this to individual states. By the way, nationally, the COVID wastewater level is in the low category at this time. And Alabama, since it's up there, that is also in the moderate category at this time. Now, going to Arizona, let's see, where is Arizona? There it is, Arizona. You are low for COVID at this time. And when we take a look at New Mexico for COVID, we do see New Mexico is very low at this time. Influenza A in wastewater, low nationally. And now let's take a look at what is going on with, first off, Alabama is going to show up again. So Alabama is moderate at this time. And when we go to take a look at Arizona, we do see Arizona very low at this time, but you only have 2 wastewater sites. So who knows, if we had more wastewater sites there, could be a different story. Now taking a look at what's going on with New Mexico, and New Mexico is also in the low category at this time. Going back to wastewater scan, we want to switch gears here. We want to go up to take a look at what's going on in Vermont, because I believe Vermont was rising. Yeah, Montpelier, which is the capital of Vermont, we're starting to see a rise for COVID at this time, and it is listed in the high category. And look at that. Yeah, those pathogen levels, they are starting to increase. RSV, a little bit of an increase. I hope that corrects. COVID, RSV, Influenza A, Influenza B, all listed in the high category at this time. HMPV is low. EVD68 is low. Norovirus has rapidly gone up. Maybe the wacky movement at the end, but it is high. That is a big increase for norovirus. Hepatitis A is low. Mpox Clade 2 is low. And Clade 1B is also in the low category at this time. So, yeah, Vermont does have some COVID problems. Let's go down to somewhere in the south. And after that, then we are going to call it a day. We'll take a look at the Midwest or something in relation to the Midwest tomorrow, because I don't think we're getting an Ohio update this week. I don't know. Stay tuned tomorrow. COVID in Atlanta, Georgia area. This is Clayton. This is 294,000 population. COVID not calculated, but we can see here the levels. They have dropped. RSV has dropped. Influenza A, Influenza B, HMPV, EVD68, all dropped. And norovirus at this time is, for the most part, just holding steady. Hepatitis A, a few detections of that, and no detections of Mpox at this time. Alrighty, folks, that does it for the Wednesday edition of the Virus Update. We'll have another Virus Update again tomorrow. If you enjoyed this update, give it a thumbs up. Subscribe if you're new down below. Share this video with anyone you know. Hit that notification bell. Leave your comments down below. Quick note about comments. I may be slow to approve some of them today. I have made more people where your comments get automatically approved. But that's because I'm going to be out at work this evening. And remember, check me out on the new Facebook page for Data Report. It's brand new, and I hope to see more people there. Hey, maybe the comment sections there will turn into a community. Wouldn't that be fantastic? Alrighty, folks, thanks for watching, and have a great afternoon. I will see you all again tomorrow, but until I see you again tomorrow, stay safe, everyone. Take care. Bye-bye.